I'm going to pass you over to Cheryl. So let's give Cheryl a big round of applause and a wow welcome. I'm delighted. Her presentation's unbelievable, so I'm really looking forward to hearing her speak. Is this your first speaking job, Cheryl?
Two practitioners, yes.
Yeah. So let's be plenty of support. If you've got a question, Cheryl will tell you whether she wants you to ask as we go along or save them for the end. Yeah, I'm very much looking forward to this. Thank you.
Hi. So I'm Cheryl. For those of you who know me professionally, I'm known as the Good Skin Guru. That's kind of my online brand. And I'm going to be chatting to you today about healing acne from the inside out. So the way that I treat my acne patients has changed dramatically in the last 18 months. I think when I first started treating acne, I was heavily focused on the product and solving all of my patients' issues with a facial or with what they were doing at home. And I probably felt quite a lot of guilt if I didn't achieve that. So I am going to tell you kind of how I now treat my acne patients, and it puts a lot more of the onus on them because in reality that's what works. We are there to help educate, and we are a pathway to them to heal their acne, but they need to be as involved in this process as we are. So a little bit about me. I'm an advanced nurse practitioner and an independent nurse prescriber. I did my nurse training back in 2006 and I've been in the aesthetic and clinical cosmetic dermatology specialty for the last 7 years. Left the NHS in 2021, so I've been doing aesthetics and cosmetic dermatology full time for the last few years. I am a national clinical trainer, so I have spoken, but not like this. So I do mainly skin training. So I've got my own training academy, and then I'm also the lead trainer for Glow in the North. I focus mainly on skin health, and as I've said, last 18 months I've put a large focus of my in-clinic work on looking at the functional health element and the internal element of acne. Okay, so reframing acne care. The reason I said that I would like to do this talk today is because of a conference I actually attended last year. It was a brilliant conference. It was a panel of 5 very, very experienced clinicians, and they were talking about acne, and it was a 2-hour talk, and it was amazing. But actually what I found really disappointing was in the whole 2 hours, there was one sentence on lifestyle, one. The whole 2 hours was about skincare ingredients, what different ingredients did, what medications might work, whether that was topical prescriptions or oral prescriptions, when to refer to dermatology, and then like dermatology, Roaccutane protocols and such forth. But there was one sentence on lifestyle, and from my clinical expertise now, knowing what I know and what I do in clinic, it's such a small part of the puzzle, and I don't think it should be the main focus. So I really wanted to talk about my approach and how I now treat my patients and try and kind of change the way that we are approaching our patients who suffer with acne. So my previous acne management, as I've kind of mentioned, was solely focusing on skincare ingredients and in-clinic treatments. What I found was a lot of my patients could not afford to come in for regular skin treatments, and I still wanted to have something to offer them. So that was really what drove me to looking down this more, okay, well, what can we do to figure out the root cause? And that's really where my expertise in functional health started. So I did a functional medicine course specifically looking at acne around 18 months ago, and then I've gone on to do further training into kind of functional medicine. And I have seen a massive difference in not just my patients' acne, those who previously, yeah, we'd get results, but then they would come back and they developed breakouts again if they weren't keeping to plan. But also patients who have gone through multiple rounds of Roaccutane, and yes, it's worked for a time, but then they've gone back to develop their acne. They now have a lot more control. They feel empowered. And I think that's what we as health professionals like to do. So I kind of split up my practice into 4 main pillars when I am treating my acne patients. So this is kind of how I would outline what we work on. So the 4 pillars that I use for skin health are nutrition, and I have that as a separate one because I think it's so important. Other lifestyle factors, their individual biology, and then also skincare. So it's still in there, it's still important. It's just not the whole message. So pillar 1, nutrition. So food can either be healing or it can be inflammatory. And for me, nutrition is the first thing that we should look at with our patients, and it wasn't something I even considered before. As a general rule, I think most acne patients have been told, cut out dairy, cut out chocolate, and it's not really very helpful. Number one, I think as a psychological impact, that's them being told you can't have these things, you have to stop doing this, you're not allowed to have this nice treat. And I don't think it's not a very nice feeling for someone who struggles with acne to be told, oh, well, if you just stop eating chocolate, all your problems will be solved. But also, I don't think it's the best approach to take, and it's not the approach I take. I don't remove things as such. We do eventually, but we don't start with removing things from somebody's diet. However, there are some common triggers that are worth bearing in mind. So high glycemic index foods do spike insulin. And when we get a spike in insulin, we get an increase in testosterone and DHEA, which will make your body produce more oil, which can lead to clogged pores, acne, breakouts. We also know that trans fats, ultra-processed foods and processed oils will promote inflammation in the whole body, not just in the skin. And then also malnutrition. If we have a lack of nutrients in the body, we will have suboptimal biological processes throughout our whole body. Again, not just skin. So what we end up doing with this more functional health plan is improve our patients' health overall. And actually, a lot of my patients come to me and say that they see improvements in other things long before their skin clears. So they're not getting painful periods anymore. They aren't getting breast tenderness before their periods. Their energy's gone right up. So there are far more benefits to doing this than just clearing someone's skin. And often they actually see that first. The way that I look at nutrition is, what are they missing? So not removing things, what are they not getting enough of? So we first look at macros, and I think macros are they're talked about a lot more now with like the fitness industry. So your macros are your protein, your carbohydrates, and your fats. Personally, we definitely do look at macros, but the micronutrient is more important to me. However, protein is definitely a key thing I see people under eating. As a general rule, we should be eating between 1.5 to 2 grams of protein per kilogram of personal weight. So for ease of maths, if you were 50 kilograms, you should be eating around 75 to 100 grams of protein a day. Most people aren't getting that. A lot of my patients skip breakfast. So if you were 50 kilograms and you're trying to eat 100 grams of protein, that's like 33 grams per meal if you're eating 3 meals a day, it can be challenging for some people, but particularly if they're skipping meals, they're going to find that quite difficult to do. So we focus on adequate protein intake. Carbs, most people manage to get, but obviously if they're on some kind of diet plan, restrictive diet, we should look and make sure that they are getting a carb intake. It is important. And carbs, particularly in your evening meal, can really help with sleep. So they help your body promote sleep hormones to actually help you fall asleep faster. And then fats. Fats is the one that I think has been demonized, particularly for those of us who are of like a millennial generation. We have been told, low fat this, have low fat snacks, have semi-skimmed milk, and actually I ban my patients from having any diet foods. So, and all of them so far, every single person who's gone through my acne program, whether they intended to or not, they've all lost weight, and I put them on full fat everything. So I ban fat-free foods. Once we have done the macros, then we focus on micronutrients. And this is where I think the fitness industry have kind of taken over nutrition. And I'm not a nutritionist. I know my scope of practice and I know when to refer out. But I feel like the fitness industry have taken over this area, and all of the education we're getting on social media is from fitness experts. And they don't really talk about micronutrition. And this is where our biological processes we need these micronutrients in our diet. And particularly, again, if we are on a fitness plan where you're eating similar meals all of the time, the variety of nutrition can be really poor. And most of my acne patients who I've seen so far, those of them who have the poorest diets are actually usually seeing PTs. Not slamming PTs, just observation. So I will look at introducing anti-inflammatory foods, omega-3s, leafy greens, colourful veg. I try and get my patients to eventually aim towards 30 plants per week. So plants are fruits, veg, but also seeds, nuts, fresh herbs and fresh spices, not the powdered ones, but fresh, legumes, anything like that is a plant. That can be quite overwhelming for someone who's maybe eating very similar meals every day. So you have to work with them as a person. So what I'll normally do is for the first week, I don't change their diet. I ask them to keep a food diary and then I'll look at it with them. If they are eating like a banana every single day, they're getting 1 plant that week. It's not 5, they're getting 1 plant variety. So the variety of micronutrients is low. So I will maybe say, okay, you've done 8 this week. Next week, let's try and make a few simple tweaks. It can be as simple as throw some seeds on your Greek yogurt in the morning and get that up by 5. And we'll just try to slowly increase that, because if someone turned around to me 5 years ago and said, eat 30 plants a week, I'd be like, what? There's no chance I wasn't eating plant varieties like that. But this is what we will hopefully aim towards. Adequate protein we've mentioned, and then yes, I think there's too much emphasis on macronutrients personally, and I think we do need to be starting to focus more on that micronutrition. Vegans and vegetarians, it is a little bit more challenging, absolutely possible. There just needs to be a little bit more forethought, because there are certain micronutrients which are found in large quantities in animal products. That are found to a lesser extent in plant foods, but it's definitely possible. It just needs a bit more forethought and planning. And then we also look at the gut-skin axis. So there is a massive, massive link between gut health and skin health, huge. So I will focus on fermented foods, if they will eat fermented foods, so sauerkraut, kimchi, kefir yogurts. I will also recommend probiotics, prebiotics, if they're just not going to eat those kinds of foods. But preferably, I try and get my patients to eat whole foods. So not supplements wherever possible. Supplements are a supplement to a good diet. They shouldn't replace some of this nutrition. So we focus on a whole food focus first. And actually what I find is by them eating whole foods and adequate protein, the high glycemic index foods fall right off without me telling them that they have to stop eating chocolate. So they don't feel like I am the enemy telling them to stop all these lovely things. They just don't fancy them as much. Okay, so next is other lifestyle. So there's 4 main focuses in the rest of the lifestyle. We have stress. So stress is a massive source of inflammation in the body. Cortisol will increase oil production and also is linked with inflammation. And there is a link between chronic stress and a hormonal imbalance in the body. So for any of you who want to look into this further, a little bit of homework is looking into the OAT axis. So that is the way that your ovaries, your adrenal glands and your thyroid all communicate, and the way that the hormones being disrupted in one area of the body will impact the rest. So for example, if you have a patient who is super stressed, busy all the time, never has any chill time, really high profile job, also exercising, then they probably have a really high adrenal load. They probably have high cortisol, and their hormones will be affected. And also often I find when I look at blood work, their thyroid's affected too, which has long-term implications. So I will suggest that they find some time that is not productive. We have gotten into this habit of being productive people. We are always busy, always trying to achieve something, and actually that's not healthy. We are supposed to have time that is just chilled. And our chill time these days, for me, certainly 2 years ago, it would be like Netflix. That was my chill. But if you're watching something really exciting, your body is not relaxed. Your body is not chilling. It's exciting. You've still got adrenaline and cortisol going through your body. If we went back 100 years in time, we were maybe reading, going for walks. Life wasn't like it is now. So we need to be able to support our biological processes the way they're supposed to be by introducing some chill time. So I will say to my patients, you need to have time each day, even if it's only 10 minutes to start with, where you are not being productive, you are not intending to do something to achieve an outcome. It's just time for you. You're not reading, reading's okay, but you're not watching something really intense. You're not trying to achieve anything, you are just there. Now, I love breath work. I'm not a particularly woo person, but I like just doing what works. So some of my patients like to meditate. I've got one patient who she's got an adult colouring book and that's what she likes to do to chill out. Whatever works for your patient. It might be reading, it might be breath work, it could be something completely them, it might be low impact exercise, but I would try and encourage my patients to find something enjoyable for them that is not stimulating. The next one is sleep. So sleep is super important, and obviously a lot of these will feed into each other. They're not there in isolation. But sleep, when we are in deep sleep, that is when our bodies regenerate, we fight diseases, we heal. So if we're not getting adequate sleep or we're getting poor sleep, then we're not going to achieve that. So I mean, a lot of us have trackable devices these days. You don't need them, but I certainly do look at it. Again, I'm roughly aiming for 8 hours, if not more, of sleep, but I'm looking at their deep sleep. Are they getting 2 hours of deep sleep? And I've had patients getting 15 minutes of deep sleep, which is not enough. It's just not enough for that. Yeah. Mine goes to and from. I'm roughly around an hour and a half now. I'm not where I would like to be, but when I first started, I was probably at half an hour. So we're getting there. If you don't have a trackable device, it's fine. We just need to improve sleep hygiene. So sleep hygiene is things like, is your room dark? Is your room cool enough for you to sleep? Is it quiet? Is there things that you can implement to make your room darker, cooler, quieter? Are you getting outside in the morning? That's a really good way of improving your hormones, your sleep and wake hormones. So get outside, ideally within 30 minutes of waking. You need sunlight on your eyes for you to help stimulate those hormones. That really helps with your circadian rhythm in general. And then also screen time. Screen time's a big one. So I actually have a red light in my bedroom. So my light switch goes between natural light and red light. So in the evenings, I'm trying to reduce my red light as much as possible. And I've also got a red light filter on my phone. So if I am using my phone late at night, I can make it red. I need to do a reel on that to show people how to do that. But yeah, in an ideal world, no screen time an hour before bed. But again, work with your patient. If they are watching TV to fall asleep to, or they're scrolling on their phone in bed at night, there's not a chance they're going to go an hour. So make it 10-minute increments. Turn your phone off, put it somewhere else for 10 minutes, read a book, whatever it is. Put your Alexa on and listen to some kind of podcast that's relaxing or breath work or something, but do it in small increments until they get to that hour. Then on to movement. So daily movement obviously will help with lymphatic flow. If we are sweating, then we're going to get detoxification. So we do want to encourage daily movement in general. However, the biggest challenge I've actually seen in clinic is patients who over-exercise. And I think that that's actually been a bigger issue for my acne patients than those who aren't moving at all. It's relatively easy-ish to convince someone that a daily half-hour walk is beneficial to them. And most people can fit in 20 minutes if they're going to actually do this in a real significant way. What is harder in my experience is convincing someone who is doing CrossFit or High Rocks and they're doing 2 workouts a day or 6 workouts a week that they shouldn't be having that much exercise or that much intensity, because that intense exercise is not allowing for the body to recover. It is increasing the stress and cortisol. And I think people who are very, very into their exercise, they think this is healthy, I'm very active. So it's trying to get them to see that actually too much of a good thing can be a bad thing. And if you are not allowing adequate time for rest and recovery, you are not going to have good hormone health. Functional labs can be beneficial here, actually showing them their blood results and that their cortisol's off the charts can definitely be beneficial. But I have found that a bigger challenge. So when I work doing my acne plan with my patients, I usually say 3 times a week for intense exercise as a maximum. I have, for a couple of patients, said 4, just depending on their lifestyle, but in an ideal world, I want them to introduce something like Pilates, yoga, walking, swimming, but not intense swimming, to reduce that intensity. Certainly, at least in the immediate, when we're trying to reduce inflammation. And then last, we have environmental, which leads into stress. So we've got environmental stresses. Do they have mold where they are? What's the air quality like? EMF, so electromagnetic radiation. Ideally, we shouldn't have like phones in our bedrooms when we sleep at night and stuff. Use your phone on loudspeaker. These are all very small things, but we know that they are disruptive to hormones. So again, if you add lots of small things together, you can see quite a big result. Then on to biology. So I tend to look at 3 areas. So I will look at my patient's liver health. So the liver is key to metabolizing hormones in the body. And obviously it helps to detoxify us. Now, if our liver is overburdened with things that are very commonly used to treat acne, such as contraception and antibiotics, it might not be as effective as it could be. It also includes other medications and alcohol. So again, some of our patients will have more of a liver burden than others, but we want to try and improve their liver health wherever possible. Our estrogen is detoxified via three different pathways in the body, and there are preferable pathways that are used when the liver's healthy, and there are actually less preferable pathways that the body will use if needed, which are potentially, well, we know that they lead to cancers. So we do want to improve liver health where possible. And again, usually I will support this with nutrition. So cruciferous vegetables, NAC, B vitamins, hydration, reducing toxins wherever possible. I've got a water filter under my sink. It's attached to my tap. So the water coming out of my sink is filtered at source. All of these things do make a small difference, which add up. We've then got hormones. So I do work with a functional lab, so I do testing on my patients, but you don't have to. Sometimes you can figure out just from a consultation what potentially could be going on. We know, again, testosterone, DHEA stimulates sebum and keratin production, which can lead to acne. Common in polycystic ovaries, perimenopause and post-pill acne. So we want to help support hormone health. We want to address adrenal issues, so that links into the stress. And also insulin resistance. So for insulin resistance, I might say something like, after a meal, go for a walk. We know that this improves the insulin spike that you get. Or if you are having something sugary, have some healthy fats alongside, because that also helps prevent insulin spikes. Then gut health. So again, dysbiosis can lead to leaky gut, which leads to systemic inflammation. There's also things like candida and SIBO, which are linked with chronic inflammation and acne. And again, antibiotics lead to a reduction in all bacteria, good bacteria and bad. So if someone has had multiple courses of antibiotics for their acne, which I see very commonly, we do need to look at replenishing their gut health, whether that is with probiotics or with your fermented foods. Oh, and I love this quote. So a lot of my acne patients will say to me, it's not fair. My friend can eat whatever she wants, does whatever she wants, and her skin's fine. So I love this quote, and it is, our biology is written. All of us are genetically predisposed to different things. We know that. You'll have a patient who smoked their entire life and never got lung cancer, and someone else who smoked for 10 years and did. So we do have our genetic predisposition. But whilst our genes may load the gun, our lifestyle pulls the trigger. So there are things we can do to reduce our risks. And I do think that for someone going through my acne plan, they come out of the other side a far healthier person, not just their skin, it's everything. So I think that as much as it may be perceived as a negative thing, they will end up in a much healthier position long term. And then last and least is skincare. For me, this is the cherry on the top. It is not the whole piece of the puzzle. I used to rely on skincare, and as I said at the beginning, I'd feel so responsible if my patients weren't completely clear. And actually, it's really unrealistic. So if you were trying to lose weight, you cannot out-exercise a really poor diet. You can't out-skincare acne for some patients. Some patients will respond to skincare really well. Some will respond to skincare and treatments. Some need that additional lifestyle support. With the best will in the world, not addressing it will never heal their acne. So what I do in terms of skincare, actually, the amount of actives I use these days are far less than they ever were. So I take a less is more approach, looking at barrier, make sure they're not overstripping the skin, quite hydrating. And normally I'll do a barrier repair protocol for 6 weeks anyway, just so I know that their skin's in a decent position before I add in what I call supportive ingredients. So rather than hammering them with actives, which is what I used to do, and I would normally start low and build and build and build, and they'd end up on with quite an extensive routine, not extensive, but quite aggressive. Now I think more, okay, let's add in some supportive ingredients. So you've got niacinamide, which is obviously anti-inflammatory and can help with your post-inflammatory erythema, salicylic acid if they're particularly oily, and then obviously you've got your things like azelaic acid and gentle retinoids if you are wanting to help some of that keratinization and also the post-inflammatory erythema. But I use less than I ever used to. I don't have patients on, an exfoliating cleanser, exfoliating toner, salicylic acid here, benzoyl peroxide there. It's far simpler than it ever used to be. And then I do avoid irritants wherever possible. So fragrance, alcohols, essential oils, which is great for medical grade skincare. We don't tend to have those things anyway. So from prescription to prevention, we're all healthcare professionals here, are we? Or a mix?
There were some level 3 therapists as well.
Either way, so health promotion is vital, and as a nurse practitioner, health promotion was something I massively dealt with in the NHS. It wasn't just, you know, someone had a lung condition, you'd do smoking cessation. It would never just be, oh, here, take this inhaler. And I feel like that's the piece of the puzzle that's maybe missing a little bit in our specialty. And I don't really like to call it an industry. We are a specialty. And I think health promotion has been missed a little bit. And we are focusing on what active ingredients work, what treatments work, and we're forgetting the most important piece of the puzzle, which is the patient. And what are they doing at home, and what is leading to them having these issues. So functional medicine shifts our lens from what drug or what skincare ingredient are we going to use to treat to what's the root cause, what's actually going on in this person's body. The skin is the largest organ in our body. It is showing us that something's going on inside. It's not an isolated thing. It's a whole system approach. We can empower our patients through education and help them take accountability. And it's great for us as practitioners, obviously, because I used to feel such dread of, oh no, she's still breaking out and that's my fault. But equally, it's so empowering for them to think, oh, actually, I know what I'm doing now to reduce my acne. And yeah, I'm going to have a weekend where I'm ignoring everything because I'm on holiday, and that's fine because I understand that I might get a little bit of a flare up. But after Christmas, I used to get so many inquiries because people would flare up because they were eating worse than normal. The sleep routine went out the window. They were drinking alcohol. But this helps them understand their body in a way that then they know what they're doing and they're really empowered. Acne shouldn't, in my opinion, I don't think we should be prescribing contraception for acne at all. I get it, they work, and antibiotics definitely have a place. But I think that they're being overprescribed and it's too easy to go to. We are healthcare professionals and health promotion shouldn't be forgotten in our specialty. However, little note at the bottom, work within your scope of practice. Scarring is still a real concern, and if you have a patient with particularly bad cystic acne and you feel that this is outside of your scope and you do want to refer, absolutely do. I probably refer less, but I will still have patients who I'll say, actually, go and get this under control first, and then we'll work afterwards to not have you rebound. Okay, so how to integrate it into practice. I obviously do a 12-week acne plan, which is quite intense for the right patients. Not everyone's in the correct position mentally to do that. So if my patients are not, I'll work on one pillar at a time. And what I would say is try and figure out what the low-hanging fruit is. So it's probably fairly obvious from a consultation, if you go and do a lifestyle consultation, what they are doing that's like, oh, okay, it's probably that, especially if you look at the 4 pillars that I've mentioned. So if you've got a patient who they say that they're living off of takeaways, then you know it's nutrition. If they're getting 4 hours sleep a night, then you know it's sleep. So start with one of the pillars, work with them to support that, and small changes can equal big results. Once they're successfully doing one, you can move on to the next. If you have someone who's a bit more ready for it, then you can go all in and look at everything all together, which is what I do with my 12-week program. But not everyone's in the position where that's realistic. Collaborate. So sometimes, particularly for gut health issues, I am not an expert in gut health. If I've got a patient and we've done the basic stuff and I still think there's an issue with their gut, I will refer out to nutritionists. You might want to work with someone like me who does like the 12-week coaching program, or functional labs. I do like doing functional labs. And then consider, what is the body trying to tell us and what is driving the inflammation? So whole person, not just the skin. The skin is a symptom, not the whole thing, and we're looking at a systemic imbalance. Consider your 4 pillars: nutrition, lifestyle, biology, and skincare. Treat the root cause, which requires us looking at the person as a whole and treating and helping them in a way that will actually help them and not overwhelm them. And then, yeah, functional medicine helps to empower patients and helps us promote health, not just prescribe treatments. Any questions?
Sorry, how many different plans did you say you eat
30.
A week? 30 weeks.
30 weeks. So I was once put on a fitness plan and I was told to eat the same 3 meals every day, just purely from a weight loss perspective. And when it was awful. And I've looked at that plan since and there was 7 plants, just 7. So he was looking at it from a weight loss perspective, but actually from a health perspective, it's not healthy at all. So yeah, we should be aiming towards 30 plants a week. It sounds really overwhelming, but like I get 7 plants in 1 meal now. If you are able to cook from scratch, it's dead easy eventually, but it's an adjustment as with any kind of lifestyle change. Yeah, Gemma.
Do you just apply this to acne patients, or we do any inflammatory skin condition?
So you can do rosacea, eczema. It's not the area, so the course that I did was specifically looking at acne. The functional health stuff I'm doing now is more general. So again, I'm only 18 months into this. By no means do I know everything. And as I learn more, I'm incorporating it with other patients. But my 12-week plan at the moment is just for acne, because eczema is not something I feel like I know enough about. But you can absolutely, this will reduce inflammation. It will improve biological processes. So it's going to improve anyone's health. I have done one from an anti-aging perspective, which is more looking at reducing, I do like glycan-age testing in clinic, so we look at the biological age. And so I've done one from that perspective. But in terms of like rosacea, eczema, I tend to just do the 1 pillar at a time just when I see them, rather than as a 12-week course. Yeah.
As a former acne sufferer, been on Roaccutane, would not touch it with a 10-foot barge pole again.
Yeah.
Mine was definitely hormonal, because it was when I was a teenager,
Mm-hmm.
and it cleared up a bit. Also down to the job, because I was dental nursing, so maths.
Yeah.
Beautiful skin when I was pregnant. Absolutely awful after I had my daughter. Awful. Dermatologist, Roaccutane. But a lot of dermatologists, I look back at my pictures now, I'm rosacea.
Yeah.
I'm definitely rosacea acne. But I'm looking at my pictures, you can see it's rosacea. A lot of dermatologists, I don't have much
Didn't pick up on it.
dermatologists, because they just see spots and say, Roaccutane worked for me. It did, and I was pretty desperate for it, because it really does not your confidence. But there's a lot, when you're saying about plant-based and things like that, I get them in the plants in, there's a lot of foods that do cause sugar spikes as well.
Yeah.
So a lot of people are good on the FODMAP diet, for example. You can eat certain, it tells you what spikes your sugar and things like that. Yeah, there's a lot still to be learned about.
Oh, 100%.
Skin conditions, isn't there?
I think we're just scratching the surface, to be honest. And I think with in relation to spikes, so you can actually get, I don't know if I've done it where I've got a glucose monitor on me for the last like 2 weeks.
Yeah.
And you can do your own like little experiments to see what raises your blood sugar. That's why I try and focus on, I didn't get to go into it in that much depth, but kind of what's going into your meals and making sure that you do have all macros, because adding in something like healthy fats and some complex carbs can really help to prevent those spikes. Yeah. So I've got a patient, she was spiking with her breakfast every morning, and all we've only changed, she's put in a few fresh spices, like cinnamon and some nuts, and she doesn't get that spike anymore. So you can kind of, but everyone's different. People will get different spikes depending on what it is. But yeah, I agree. Yeah, but you don't have to go down the Zoe route. You can just order them from a pharmacy, and they're a lot cheaper. I don't really rate Zoe. Obviously, the 30 plants a week thing, that came from Tim Spector, who is but I think Zoe it's highly focused on vegetables and probably reducing meat, and I don't necessarily think that is the healthiest thing either. I think it's a personal choice, obviously, but I found Zoe very like vegetarian friendly. Yeah. Yeah.
So recently I've had like a few of my clients come in asking me about their daughters as well. I've been suffering quite bad with their skin care and stuff.
Yeah.
I've found there's a common trend now. GPs are just pushing out steroids, doctors cycling.
Yeah.
That's all they're doing.
Yeah.
So then when I've been trying to encourage my clients like you've done through diets to improve like their skin health as well, I found it's being passed down as well, like to their children, like to the younger children. So they said it's starting to happen. Have you found that too? And
yeah.
When you've just said about what you went through, your daughter, would it be something you would then kind of into your meal prep?
No, mine was after I had my daughter. So when I was pregnant, my skin was immaculate. My hair, my skin, nails, everything beautiful. Best it ever be. But after I'd given birth, my skin was just horrendous. And I'm talking 25 years ago. So products have come a long way since then. But I know now with a lot of kids, because they're so hot on TikTok.
Yeah.
And so you walk in Sephora and it's you just like that.
Yeah.
But they all, I mean, 10-year-olds are getting drunk elephant and
Yeah.
that further down the line.
My 12-year-old goddaughter went and bought retinol from Boots just before Christmas.
That was what I was going to ask you this question. So like now you see a lot of these products on the shelves and they're readily available for anyone to go purchase. But for the younger generation, it's having a worse effect. Yeah.
I do see 16 and above in clinic, and I've treated a few 15-year-olds with, I normally just email my insurance and get permission. And I don't go into this specifically because I think at that age, I am not a nutritionist and I don't want to potentially cause any kind of eating disorder or anything like that. So I'm very cautious around that particular age group. So I go in with fairly basic skincare and I normally talk to mum. Because often it's like sleep stress, they're burning the candle at both ends, they're getting up at, like, teenagers really should sleep longer than we do and they're going to bed really late and then they're getting up for school. It's a stressful time, they're doing exams, so I try and help support mum or dad to improve lifestyle. I don't really like talking about, I'm really cautious about patients with eating disorders when I do my acne programme, because I do think I'm not in a position to talk about nutrition with somebody who's suffered with an eating disorder. And I just think for the same reason I don't like to discuss with children, but I do treat 16 and above. But normally my skincare routines are fairly simple and I'll just talk very briefly about eat well, move a little bit, stress and sleep. But I don't go as intensely with teenagers, but parents can often pass it down to their kids, yeah.
You mentioned Tim Spector.
Yes.
My children started to get like acne and stuff, and one of my friends said, look, Tim Spector, you know, if you cook the food, they get it cleared up like within a month.
Yeah.
It was amazing. So yeah, definitely.
I think whole foods is probably, that's why I put nutrition as a separate to the rest of lifestyle, because I think we are relying a lot on ultra processed foods. And I think if you can have a whole foods diet, that will sort a lot of it, because we are just malnourished, and I can see that from functional labs. I've not done a single set of bloods for a patient, looked at a single set, and they've not had some form of malnutrition. So whole foods diet, absolutely, definitely helps. Yeah. So depending on if you are a CQC registered clinic or not, if you work externally, so I normally get my patients to order through U3 Visited, and there's, where did you say you used, Gemma? Good Body Clinic. So if they're getting their bloods and you're interpreting them and you're not diagnosing, you don't need CQC registration. If you are wanting to do the bloods and diagnose or do it more in-house, then you do need CQC registration. But yeah. Oh, right. Oh, yeah, fine. Yeah. Find me on Instagram. I'm the Good Skin Guru. Yeah, that I can do yours. Because you can do it remotely as well. So I can send anywhere in the UK a phlebotomist to your house, or you can get a phlebotomist to your house. So I work with patients online all over the country.
Any other questions? What does the 12-week plan look like? How often do you see patients?
Yeah. So for my 12-week programme, I start with a 2-hour consultation, so it's very in-depth, and we go into lifestyle with a fine-tooth comb. Then I will see them, so I'll write them a protocol, which is like their starter protocol, because we're still waiting for functional labs at that point. All of my patients so far have been women. I've not had any men come to me, so they have to have their bloods done on day 21 of their cycle. So again, they need to not be on contraception. They can't be on contraception because it fucks with the hormones. No, you can't, yeah, because I can't get a true image of what's going on with their hormones if they're on fake hormones. So they have to be off all hormones for 3 months before I can work with them. So then they'll get their bloods done on day 21. They've got their first protocol. We do a check-in once a week. That is with a check-in form, and I will message them, but once a month we do a FaceTime. And then once we've got labs back, I will do protocol 2. So we'll alter the protocol based off of what we find from the bloods, and then we continue checking in. I'm very honest with them. By week 12, I'm not expecting them to be fully clear of acne. They just have a much deeper understanding of their body and they're on the right tracks. They will have seen a difference by that point. Certainly, it's not just their skin. Like, everyone's noticed something else as well as their skin, but they can then continue that at home. And then I do offer them, if they are struggling at a later date, they can do like a single one-off check-in, but normally by the end of that 12 weeks they're on a pretty good, they know what they're doing. Yeah. Thank you very much.
That was absolutely fascinating.